Hi guys, thanks for joining me again. I'm Mark Thompson from Thompson Chiropractic and Superior Recovery and Performance. Today I wanted to talk to you about the lacrosse ball and how it can fill in some of the gaps of the foam roller. So you can use the lacrosse ball any place that you use the foam roller. The foam roller tends to be a little more gentle and it works those large muscle groups much more effectively in many cases than the lacrosse ball. But the lacrosse ball can really get into those tight little nooks and crannies. So the major areas that I like to use it on are the upper trap and levator scapula, on the actual shoulder blade, and then again like in the hamstrings. Note that you can use it anywhere. It's great for working the forearms out if you have wrist or hand pain. You can use it for plantar fasciitis. It's a wonderful tool. And I'm going to show you 2 or 3 of the top things, and then you're just going to have to extrapolate from there. Know how you can use the ball to work any muscle. Okay? All right. Stay tuned. Okay, so here's the shoulder. This is the top edge. Comes down the medial border, goes up underneath here. And there's this little ridge of bone right here. And there's a depression above it. That's the supraspinatus. And then this muscle right in here is the infraspinatus. And this cut muscle actually is called the teres minor. It's responsible for a lot of shoulder pain. And then we can look up here. This is this muscle that goes up here to the back of the skull. This is the levator scapula, and it actually attaches to the front edge of the shoulder blade or the scapula. And then on top of this muscle, we have the upper trapezius. And we can get all of these with the lacrosse ball. Hi guys, we're going to talk about how we can work the shoulder with the lacrosse ball. I like to start typically on the top, right where the muscle of the upper shoulder and the neck kind of tie together, right in this region. And that's going to be the upper trapezius, and then just behind that is going to be the levator scapula. You take your ball, and you need an interior door jamb, all right? And preferably one without that doorstop molding in the middle, because we need a bit of motion in here. So what we're going to do is we're going to put the ball up here, and I'm going to lean into it, and then you can kind of roll back and forth right on that muscle, okay? And then I'm actually leaning down and in, and that puts the pressure right on that levator scapula where it attaches to the top edge, inside edge of the shoulder blade. Crikey, that's tender. So you're going to work that. A lot of times I like to breathe through it. So what I do is I take a really deep belly breath, expanding your abdomen, and then you force it all the way out, and you go to where there's no air left. You're really contracting the lower abs, and you're really leaning in on the ball. And what happens is it just melts those trigger points away. So now we're looking at the front of the shoulder, and this muscle right here that attaches to a little hook on the shoulder blade that sticks through to the front. You have this muscle that attaches here and comes down and attaches to several different ribs. It's called the pec minor, and it is a stabilizer and one of the rotator cuff muscles, and we're going to talk about how to treat that in just a second. We're going to come around and work the pec minor, the pectoralis, I can't even say it. The pec minor starts up here on a little hook that is part of the shoulder blade. It sticks through to the front. The pec minor attaches there and goes to several of the ribs. So we're going to take the ball, we're going to start here and work in angles going across at an angle and then straight down. We're going to find those trigger points and work them out. So it is in the little depression just off of the shoulder right here. That's where we're going to start. I'm going to lean, again, in and down, and then I'm going to use my toes and kind of roll up. Sometimes you may have to adjust the ball. There we go. Now we're getting it. And then you're just going to work across, again, breathing through those really nasty spots. All right? So that is how you treat the shoulder with the lacrosse ball. And for all you sissies out there that don't like doing things on a razor's edge, we can actually do the lacrosse ball against a flat wall with a couple of exceptions. So same thing, you're going to place the ball up here, you're going to roll around onto it, really lean into the ball, breathe through those nasty points, reposition, go up and down. It's all the same, except it's very difficult to do the top of the shoulder, okay, and the chest without some place for your head to go. If I'm like this, I'm not saying it's not possible, but it's just easier to do on there. As long as you kind of put your hand up there and kind of make sure the ball doesn't roll off of the door jamb, then I think you're going to be good. But sometimes for the back, and whenever you get off of the shoulder blade, between the shoulder blade and the spine, the wall is actually much better. So a lot of times you're going to have a problem with the hamstrings, and it's going to be right here where the two muscles connect, and it's held together with some fascia, and a lot of times that will get knotted up, and so this is going to be where you have the problem. And the best way to treat it is going to be seated, and I'll show you that in just a minute. Okay, to do the hamstring with the lacrosse ball, what I like to do is sit down, and honestly, at home I have a wooden seated chair. It's like one of the dining room chairs. It works fantastic, but you need something that's fairly firm. You're going to take the lacrosse ball and you're going to place it under on the hamstrings where they want to separate and go onto either side of the knee. That's about where you want to start. That's where most of the problem usually is. So you're going to start here, and then I kind of support myself and I roll, placing a significant portion of my weight on the ball. It is usually, if it's tight, it's going to be very tender. You can roll from here all the way up to your bum, but because that's right on the ischial tuberosity is where the hamstrings come up and attach to. It can be tender anywhere along the way, but my experience is most of the time it's kind of the lower third or the lower half of the hamstrings. So there you go, lacrosse ball for the hamstrings. Okay, so that's it for lacrosse ball. Thanks for joining me. Hope you learned something. Hope you apply it. See you next time.